We are live now.
Good evening, all. This is Dietitian Flora. I welcome you all for the diet topic. Today, I'm going to talk about healthy mom, healthy baby. It's all about a healthy pregnancy diet. So today, I'm going to talking about pregnancy, like what to eat and what nutrients it is required in your daily life. And during pregnancy, eating a healthy habits which affects your baby. Your baby depends on a good nutrition of growth and development. Making a healthy food choices and having a balanced diet during pregnancy will prepare your baby for the long life and long life health. It depends on the diet, what you eat. Okay, the food habits that affects your baby. Your baby depends on the growth. Okay, the food what you eat, the good nutrition, it is for the growth and development of your baby, which makes you have to make it into a good healthy food choices by a balanced diet. In overall your pregnancy, it will help you for your baby's lifelong health. So let's talk about today pregnancy and nutrition, like psychological and metabolic changes, okay, in your body. Healthy weight gain during pregnancy recommends like intake of energy, protein, fats, minerals, and vitamins. What kind of vitamins you need, what kind of proteins should have to be included in your pregnancy diet. That is more important. And special food care, as well as today's recommendation about the general recommendations about the food intake during the pregnancy is like helping against moving morning sicknesses. Food pregnant women should be avoided, and gestational diabetes and pre-eclampsia as possible for the nutritional factors. Uh, come, let's see like how many calories do you require in a day? Okay, like how many extra calories do I need to add up? Okay, it is a myth, like it is not like actually it's a myth, like what you need to eat for two. Okay, it is not required to eat for two during your pregnancy. You have to need extra calories. You have to add up an extra calories by gradually increasing in your calories as your baby develops. Will be right, just a right nutrition. You have to. It's for example, it doesn't, as the picture shows that you don't need to require like two eating a two apples in a day. It's like a double eating for the two, one for you and for your baby, for the fetus. Okay, it is not nothing like that. So slowly, gradually, you have to increase your calories according to your trimesters. So let's see, like in the first trimesters, no extra calories needed, like because in the first trimesters you'll be having like so many complications like nausea, vomiting. You don't feel like so many aversions we'll be having. So slowly, gradually, like second trimesters, you can increase as well in your first trimesters, but we have to check like how much quantity food are you able to eat it. Like okay, so gradually you can increase like 100 kilocalories to 250 kilocalories, and in the second trimesters you can increase like approx 300 to 350 calories per day, extra calories per day. In third trimester, as the week goes up high and your baby grows up high, okay, as and you have to increase accordingly. That properly, it's appropriate calories should be count around like almost 500 kilocalories per day. You can include it like extra, like almost you can day in a per day you can include like 2000 200 to 2500 kilocalories per day. Normally, what we eat is like almost 1500 to 1800, but adding up extra, it should meet up to like 2000 to 2500 kilocalories. But not calories count should be counted from all the food groups. Okay, not only the extra calories should come from the nutritious food. Okay, such as the protein should meet, and the fat. I mean the low fat dairy products, the vegetables, the legumes, the fruits, and the whole grains. Everything should be included. From all the food groups, the extra calories should be included. And so, as we are talking about the extra calories, what do you mean by extra calories? See, as I told you, like 150 extra calories in the first trimester per day. Extra calories is nothing but one banana plus 5 to 6 almonds. Okay, either one banana plus 5 to 6 cashew nuts, or one apple. See, it includes, you're adding up, we're not adding like two bananas there. So we are adding into a different food groups. Okay, so we are taking banana as well as nuts, as well as you have to choose like from a different food groups. Not only only sticking to the nuts, not only sticking to your fruits. Okay, uh, this is the way we have to plan accordingly, and we have to add up your extra calories. So 350 additional calories per day, as I told you, as the trimesters goes up, you have to increase the calorie count. So banana, I mean nuts, plus 1 glass of milk, which makes you around 350 kilocalories extra. So one portions of cooked vegetables, a two handful of almost two servings, at least 1 to 3 servings of the fruits and vegetables should be included. And oil is there, good fat. And there you can see the legumes, all the cereals, pulses, and good starch, good carbohydrates, as well as milk. Okay, if you see the every picture is from a different food groups. Okay, so either you take the nuts, either you choose like cereals, vegetables, fruits, milk. It is all from the different food groups which has to be included by an extra added kilocalories. Okay, so the next query is like everybody has like how much weight uh, should I expect to gain it? Okay, weight gain during pregnancy is important for the development of your fetus growth, as well as your placenta, the amniotic fluid, everything grows. Okay, not only your fetus should grow, but also your placenta will grow, your amniotic fluid will grow, your breast size, your uterus, and the blood supply, as well as the fat stores. Whatever you eat, everything stores. Everything stores as a tissue. Okay, which can be useful for the future purpose. Okay, by a good food which has to be stored inside. Okay, the normal weight gain is between like 0.0 to 4 pounds. It's nothing but like 500 grams. Okay, during the first trimesters, it's a good weight. Okay, gaining a weight like in a month, you cannot gain like 1 kg. It's not a good weight. Okay, so 1 pound per week during the second and third trimester is a good weight. So we have to be check every time like how much are you gaining your weight. See, increasing like almost 2 to 3 kilos in a 1 month, it's not a good weight. Like gaining like 1 kg or 1.2 kgs, as well as you have to check like how much are you gaining, how much is your fetus weight, how much as your body has been, the hormonal changes has been developing by as the trimesters goes. Okay, always remember that pregnancy is not the right time to lose the weight or to cut down the calories or you cut down the protein. So never do a diet, okay, or never think about your weight loss. If you're gaining the weight, except always see for a good weight gain, but not for the extra weight gains. Okay, overeating, always you'll put on the weight. So always say no, like overeating. You have to include the extra calories from the different food groups, but not adding a double. Like you will be having so much of cravings, like sweet, salt, everything. So always make sure you have to include from a different food groups, but not eating only one particular food group, which will put on more weight. Okay, always think about getting the essential nutrients from your diet. So always think about weight gain. It depends. Ideal weight gain during pregnancy depends on your pre-pregnancy BMI. It is very important, like how much BMI are you, like before you are getting cancer, okay? Before you are positive, okay? Please check your BMI. If you're obese or if you're normal, you can gain up to uh, see optimal weight during your pregnancy is like if you're normal, like almost if your BMI is around 18 to 25, 25 below, you can gain up to 10 to 12 kgs. Okay, if you're overweight, above your BMI is above like 25, you should gain only 10 kilos in overall 9 months. Okay, in a whole pregnancy of your journey, you have to gain only 10 kgs. Okay, if you're obese, if your BMI is more than 30, okay, you cannot more weight gain more than 8 kilos. Okay, if you are like twins, if you are gestations like twins, you can gain up to 23 kilos, like 20 to 23 kilos. Again, depends on the BMI. If your BMI is normal, then you can gain up to 23 kilos, but not. Uh, depends on your like calorie. There again, if you are having twins over there, twins or triplets, like okay, you can aim like having each 300 kilocalories per day for each fetus. It counts because for the both twins you have to get equal amount of the same calories. Okay, so you have to be well planned, okay, accordingly, and you have to be uh, include the essential nutrients, like what should be included equally for your both the twins. Okay, pregnant woman has, again it makes for the normal pregnant woman and the twin pregnant woman, obviously it increases the calories, it doubles the calories. See, if a normal pregnant woman is taking like almost 300 extra, and the pregnant woman should have like even more extra. So you have to be thinking about like 200 kilocalories to 2,800 kilocalories per day. So weight gain and the calorie need for the triplets is high, should be calculated by a healthy professional or a doctor as a dietitian. Make sure you meet a dietitian or a doctor uh, to know like how much to be added in your gestational time. So let's talk about the essential nutrients. Like what are the benefits? Like what are the essential nutrients? Let's talk about the main thing is the folic acid. Folic acid is needed for your baby's brain development and the spine. Okay, folic acid also helps you make a healthy pregnancy. Enough folic acid is important for the preventing the neural tube defects. Okay, the folic acid which makes the cell, okay, which makes the cell, okay, and it's a major defects of the which is more important to develop the brain and the spine. Okay, almost 70% of all the neural tube defects can be avoided with the enough folic acid. The make sure you have to be included not only through the supplements, as well as you have to be included by normal food sources. What you have to be which is folic acid, which is available in the food sources like green leafy vegetables, avocados, legumes, beans, orange, and fortified bread and the cereals. Okay, make sure the more number of each and every day you have to be included green leafy vegetables either in the form of curry, either in the form of parathas like methi paratha or spinach parathas. Okay, with less oil. Again, the calorie count is more important. The way the preparation it is more important. So try to be included either in the form of dal or in the curry based or in the form of raita, either in the form of soups, either which recipe is your plan it accordingly and make sure you include it every day to get enough amount of the folic acid, okay, which is more important to develop the brain and the spine. Protein which helps the baby's tissue to develop and also to develop and repairs the breast and the uterine tissue muscles and also the blood during the pregnancy. Protein is the main the building block of the body, which can repair and which can build, okay, which can build all the muscles, your the cells, okay, as well as your bone, your teeth, everything is important. Protein is more important to develop and repair it. So protein usually we get from the meat and meat products, as well as plant sources we get from uh, nuts, legumes, as milk, eggs should be included to get enough number of the uh, protein. So iron is also main thing which brings oxygen, which makes hemoglobin, which protein a protein in which the red blood cells that brings oxygen. Iron is brings oxygens to make your tissues. The amount of the blood in your body increases during the pregnancy. Okay. Now, always it is more important if you are anemic. Make sure always the iron, the hemoglobin should be about like 11 or 12. If you are anemic, if your hemoglobin is less than 10, you have to be in, you have to consult your nearby doctor or your gynecologist to add up the iron supplements, as well as you have to include a lot of iron rich foods, iron rich food sources like lean meat, seafoods, which is available, and also cereals, fruits, vegetables, beans, and nuts. And to absorb it, main thing is vitamin C. To Vitamin C is most important to absorb the iron. So always make sure you, when you have the iron-rich foods, include 1 glass of lemon juice with less sugar. Okay, to proper absorption of the iron. Calcium. Calcium helps, and it also develops in babies' bones, teeth, and muscles, heart, and nerves function. And it also helps to needed for the fluid control. And calcium is more, as we all been aware, and we all know that calcium is more important to develop our and also makes our teeth, bones stronger. So always include calcium and vitamin D, especially for the absorption of vitamin D. We want calcium also. Try to include like milk, yogurt. Either if you're not have if you're not liking to have milk and milk products, try to have it in the form of yogurt with, or else in the form of custards. You can include also, and the plant sources are like broccoli and kale and tofu and nuts also can be included in the calcium-rich sources. So vitamin D, as I was talking about the previous slide, vitamin with the calcium and vitamin D is also to be maintained at proper levels of calcium and phosphorus. So which helps you the same, as the combination goes on, it maintains the proper level of calcium and phosphorus, which builds up your baby's bone and teeth. And the vitamin D, the main source of the vitamin D is sunlight. Make sure you sit in the sunlight early in the morning before 9 a.m. Like, make sure you uh, feel a burning sensation and do not use any kind of um, this, and make sure you do not cover yourself and expose yourself to the sunlight. At least you have to sit around almost to 15 to 20 minutes spend for the natural vitamin D. And also the sources of food sources would be like salmon, the fish, and the tuna is also the fish, the mushrooms, eggs, vitamin D, and the fortified milk, and the cereals should be included in your daily diet. And the vitamin C, which is more important and needed for the wound healing, and which helps you to develop again the teeth and the bone. Vitamin C also, which is more important for the absorption of the iron, as I was talking for the previous slide, and the iron. So always make sure you get enough amount of the vitamin C, which is more important to build up your immunity, and also the fight against the antioxidant, which is more important. So I try to include more of fruits, vegetables, which are more in yellow and orange color, and which are especially like citrus fruits like lemon, oranges, sweet limes. Now, which is seasonal, which you can include it every day, like yellow bell peppers, capsicums, and broccoli, strawberries, and citrus, which is more important, you have to be included in your daily diet. Iodine, like which is also helps you to develop your brain, baby's brain and the nervous system. Enough iodine will help your brain to move, think, and feel it. Iodine is like what we have to be like. It should be included. Okay, normally what we take is like 5 grams of salt every day. That, as per the WHO, 5 grams an adult can add up in your daily diet. So 5 grams of salt you can include it. Apart from that, fish, milk, cheese, yogurt, and iodized salt, cereals and bread also be included, which makes the iodine makes your baby to feel, move, as well as and think about it. Okay, and good fat. Okay, which is more important, the omega-3, the brain development and the growth. Okay, the baby's development and the growth, which makes you to stay for the longer time, which is good fat, omega-3 and omega-6, which you can include from the fish, like polyunsaturated fatty acids, which makes your baby's organs and well as placenta, uh, which is more also helpful and for the retina development also. And salmon, the good fish, which is yeah, included like fresh river water, fish can be included like milk, cheese. Apart from this, you can also include like olive oil, olives, and flax seeds can be included, and in the green leafy vegetables, and number of good oils, vegetables oils like canola oil or olive oil, which has almond oil or walnut oil also can be included. Make sure you get lots of, try to include like almonds, walnuts every day, either in the form of nuts and the crunchy snacks or handy snacks, or else you can include it in the form of custards. Either you can sprinkle on your salads as well. But you have to get enough number of vitamin D, vitamins, calcium, as well as good fats, the good amount of protein. Everything should be included in your daily diet, and this is the what daily requirement, and the nutrients should be added every day. Like almost protein you have to be included like almost 75 to 100 grams per day. It depends, protein development increases according to your calories and the protein and the fat. As we were talking about the increase in the calories, automatically we have to increase the number of protein and the fat and the calcium, everything. So protein is mainly calculated from the ideal body weight. Okay, if you are weighing around, if your height is around the, like almost 170 centimeters, you can include almost 70 grams of protein every day per day. So as the trimesters goes, as a pregnancy, the journey of your pregnancy increases, we have to increase the protein intake also. And the folic acid, as you are added in your daily supplements by your doctor as well, you have to be included through the food sources. Okay, the what I was talking about in the previous slides, the folic acid should consume around 60 macronutrients per day. Okay, and iron should have to be included like almost 27 milligrams per day, calcium 1000 mg per day, vitamin D like 600 IGU per day, vitamin C 85 mg per day, iodine like 220 mcg per day, and like fat like DHA like almost 200 mg per day. Uh, all these should be included by the food sources, as well as through uh, uh, the supplements what the doctor has been recommended to you. You usually will have a query like, why am I taking all these vitamins, the supplements, so many medications, why you have to be included in my pregnancy? Normally everyone has been and a complaint like, if the pregnancy I'm taking lot of vitamin tablets. is that useful? It is useful to me every day. Everybody is having a query according. Should I take well, vitamins if I eat all these foods? Yes, because we might miss some of our nutrients from our foods. So eating a well-balanced diet, you may still miss some like essential nutrients in your daily diet. So including like all the first 3 months of your pregnant, it is recommended to make sure to get all the nutrients needed from a for a healthy pregnancy. Some medicational professionals recommended women still take the parental vitamins while the breastfeeding also. Uh, while you breastfeed also, the more vitamins should be included, the essential nutrients, which is more important, which cannot be added from your food sources. That is why always never stop taking all your medication. Try to include your medication as well as from the food sources which should be included from the each food groups. Okay, see if you are gestational diabetes. Okay, gestational diabetes mostly we are being seeing as in the pregnancy only you will be seeing the gestational diabetes. As you have been delivered, the sugars will get disappear. So make sure you have to be controlled. It depends on the different hormonal changes leads to a high glucose levels, and mother nutrition is not adequate. Okay, mainly overweight or elder mother are at risk. Okay, and always make sure you will be have to be check with your sugar levels every day or weekly or monthly. You have to be noted, or you have to be make a record of it. Kindly check with all your sugars like before before eating or after eating, and always include a low glycemic index. Okay, diet and complex carbohydrates with lot of vegetables, which is more in fiber, which stays for the longer time in your stomach and which is not easily digested. Okay, and the simple carbs should be avoided. The main thing for the gestational diabetes, like including lot of fiber, lot of protein with low carbs, and the same way you have to be included with the calories. So the calories can should be included. That is what you have to meet a professional dietitian or a doctor to plan accordingly, like what to eat and what not to eat, and what should be avoided in the gestation diabetes, and how to be controlled through the food, which the sugar should be in the control as well as your weight, and every second hourly you have to be planned accordingly, like what to eat and what not to eat. And apart from the gestational diabetes, the mostly the complications what we have been seeing is like preeclampsia. So preeclampsia is nothing but high BP in your pregnancy. Okay, like as the BP shoots up high, and you will be having around the proteinuria as well as the hypertension and the edema, which makes you the feet will get swollen with the edema, which where you have to be cut off all your salt intake, not adding the extra salts. Okay, as well as you have to be cut down not the preservatives like papads and the pickles, which has to be not included, and the sprinklers, salt sprinklers has to be avoided. And the normally adult, what I have been talking on the last slide, like almost adult person can include, according to the WHO, we can include like 5 grams per day. Okay, like if if your BP is high, I mean your hypertension is, your fluctuations with your high blood pressures, you have to cut down the salt intake. You have to check like almost like 4 to 5 grams. So gradually, but you have to be planned, and accordingly you have to think about it, and you have to plan accordingly in your diet. Okay, and mostly food cravings and aversions are the main cause in your pregnancy. So much of food cravings will be having in the pregnancy journey. So what kind of food cravings and how to manage them? So especially in the pregnancy. The specific cause of the food cravings during pregnancy, it is not known. Okay, sometimes you might feel of eating sugar, I mean sweet, and sometimes you get feel like to eat spicy, sometimes you feel not to eat anything else, like like so many mood swings is the main thing which causes in the pregnancy journey. So, however, the research has suggested that they may be related to the hormone changes during the pregnancy. This can make you more sensitive. Okay, sensitive to smell, taste, as well as which is more causing you to crave so much, and is also to satisfy your cravings. You have to be look along with eating a good food, as well as and which amount of food you have to be included, and the safe eating safe food in a small amount. So always the cravings everybody has, as the researchers are telling that during your pregnancy, the hormones during for the development of the hormones, you'll be having so much of cravings there. Eating safe and quantity of the food, which has to be again calculated, and you have to be added in your daily diet. So take control of your cravings, like what to eat and what not to eat, which is more important. If you're craving for a spicy, sweet and crunchy, you choose always instead of spicy, you can add the salsa like or a salads. So salads like you can mostly in the early pregnancy you have to avoid like preservative salads. Okay, not the salads which is available outside in the supermarkets, which is already cut and stored for the longer time. That is not at all good, and which is not at all hygienically, it is not included, that is not at all safe at all. So you have to be prepared at home, like you can add up like lemon to it. Okay, you can add some salt, pepper, as well as chaat masala, and you can make it, prepare it accordingly according to your spice, and you can include it, but don't go for outside like manchurias, as spicy and non-veg. Okay, which is pizzas, burgers, which is full of noodles and soft, which is full of made up of like soy sauce, which is not at all healthy in your pregnancy. And sweet, of course, sweet is also one of the craving. Make sure sweets. The more amount of sugar, the more amount of the ghee, which increases your calorie intake. So think about it. Sweet, always cut down your salt, sugars, and the white maida, which makes you cut out the calories, as well as the simple sugars. Okay, and the fresh instead of sweet, make sure you always choose the fresh fruits. Okay, cut the fresh fruit then and then, and you can have it. Okay, as well as if you want to have more, if you're not liking to have go for a sweet, fresh fruit, you can include in the form of custard, a fruit bowl. Okay, or else a yogurt. Okay, yogurt with the fruit, or with the any pomegranate, which tastes yum without sugar, which makes yourself satisfied. And crunchy, always instead of going with the handy chips like Lay's, Kurkure, and all, which are hygienically not good, as well as and that are simple cups. So make sure no junk. Crunchies always choose with a variety of fruit, I mean carrots, nuts. If you not want to go with a normal nuts, try to roast it. Okay, dry roast it, add some salt and chili flakes to that, and you can enjoy in the form of having a healthy like salted almonds. Not too much of salt again there. Think you have to be minimize them, and just to control your cravings. Make sure you have like one or two, not taking a full like handful of nuts over there, like almost one or two of almonds which are like roasted with the salt, that you can be included, but not full bowl, not a big bowl. Okay, and instead of choosing potato chips, you can use low fat biscuits crunch, which are nowadays so many high fiber biscuits which are available in our supermarkets, which is more in fiber. Nowadays, we have been available as like ragi biscuits, oats biscuits, which are more crunchy and which are more in fiber with less sugar, no sugars. So many options. Always read the labels. Okay, always choose. Okay, no maida, no sugar, which is more healthy. The fiber is more important in your snack. So no sodas. Mostly in the pregnancy, most of them will having constipation issues, no, slow digestions. So mostly my patients will be asking me around my digestion is very slow. I'm unable to have it. I'm unable to go for my stool today. Can I have one soda? No. Always sodas are no. Go with the lemon juice, okay, or else you can go with buttermilk or coconut water, but not sodas. And again, instead of candies, sweets again there, candies which not which candies are always made up of again a lot of sugars there and which is dried for the longer time, and use always dried fruits like berries, cranberries, blueberries, which will include your antioxidants, as well as which is more important. Okay, and how to control my aversions like in your food. Like if you're not liking to eat something, if you're not liking to eat when you're the smell of the meat, dairy products, and the green leafy vegetables, try in the form of you're not liking to have meat. Try to include the uh, vegetable plant sources like proteins like beans, nuts, and eggs, or else like sauces should be made at home, but cut down all the metallic flavor of, like you should not use all the artificial flavors or the colors should be avoided, and make at home normal simple basic curries or gravy curries, and not deep fried, as well as dairy products which can be included not only from the milk and milk products but also calcium rich sources are like dark green leafy vegetables or the fortified like OJ is Latin bat, which is more important to get a good amount of the dairy products. Should be make sure if you're not liking like the same, if you're not liking to go have one glass of milk, try to include in the form of yogurts as well as in other plant source based foods, and green leafy greens like nutrients which are more include, try to include a lot of which are different color like yellow, orange, veggies, which the fruits, fresh fruits, which will meet up your all the nutrient requirements. And the other thing is most important, and the morning sickness and the heartburn. As I was talking about the mood, this cravings, and the morning sicknesses and heartburn is the main cause in your pregnancy journey. And morning sickness is nothing but a nausea or oftenly with vomiting during your pregnancy. This is usually happens because the increased hormones in the body. It is the most common during your first 20 weeks of your pregnancy. So every woman who has been pregnant has the same complications, which it is the very common. As the researcher says that the first 20 weeks of the pregnancy is a very common morning sickness, and the heartburn is depends on the happens when the increases in the hormones in the body. So if you are vomiting in the severe in the worst way, please throughout the pregnancy you have to consult a doctor, and you have to include normal medication to get rid of the morning sicknesses and the heartburn. So make do not, if you're having nausea kind of, and do not cut. cut down your breakfast as well. Do not cut off your milk there. So if you are having too much of morning sicknesses there, try to consult your doctor and try to add up your medication to get rid of the morning sicknesses. So tips to control the heartburn, most of them, as I was talking about the sodas, so many complaints about the vomitings, the nausea, okay, the constipation, the heartburn. So to tips to control all these, you have to be included, like eat a smaller frequent meals, get yogurt or a drink a glass of milk, eat slowly and chew enough, avoid spicy, rich and caffeinated foods, which makes you more heartburn. So try to avoid a lot of spicy foods. Instead of the spicy food, I was talking about the salads and the nuts and the milk products. The other way, the other recipes to be included in your diet. Avoid drinking during your meals. Okay. So when you're either you have your water before you start your breakfast or lunch or dinner, but not in between your meals. Okay, when you have too much of water in between your meals, you may not have a proper full plate of your meal. Try to add your drinking water or something before or after your meal, but not in between your meal. Okay, sit up straight after a meal, but do not immediately lie down. Okay, after eating immediately, but make sure you sit straight after a meal, or else try to move around at least for 5 minutes for a good digestion. And tips to combat like morning sicknesses, like do not skip your meals always. So if you're having morning sickness, as I was talking about, if you're having morning sickness, do not skip your meals. Uh, that is what I have suggested you to meet up your nearby doctor or your gynecologist to get rid of the morning sicknesses by the medication. Okay, but do eating a small meals to keep food in your stomach. Empty stomach worsens your nausea. Okay, and the more the empty the stomach is, the more nausea you'll be having it. So always make sure you have it smaller portions of your for smaller quantities in a different number of times, but do not skip your meals. And do not stay in a warm places. Feeling hot includes nausea. Always make sure you when you cook it, most of the people be having like they cannot there are so many aversions of smells with the stronger, like when they cook, when they boil milk, when they cook the rice, and when the different kinds of when they cook the meat. So always window should be open to get rid of the nausea. Okay, make sure you should make sure you always the window should be open to get reduce the strong smells. Always exhaust is more also important to feel the get rid of the nausea as well. So do not lie down after eating, as I was talking about. Uh, Eat crackers, cereals before you get out of the bed. So as you get up, because the whole night you will be not having any, something or the other, early in the morning, the most of the people will feel hunger. So as you get up, if your breakfast is not ready yet, soak your almonds, walnuts. Make sure always you keep a healthy and ready-made snacks, which is handy to you. Which you get up early in the bed, you can include some either fruit or one glass of milk or nuts to be included in your as you get up from your bed. So do not eat spicy or fatty foods which are hard to digest. Yes, do not include a lot of spicy fatty foods. Instead of that, eat ginger or lemons, lemonades to smooth your stomachs. Okay, and let's let the condition go unthreatened, like taking iron pills at bedtime. Okay, bedtime, because most of the iron pills which makes you the stool like harder. Okay, when you're taking the iron pill which makes your stool harder, always you get include a lot of fiber rich foods. Okay, always make sure you have at least 3 liters of water. Always a good time for taking iron pills is at the bedtime, but not early in the morning, which makes you trouble the whole day. Okay, and don't forget to drink dehydrate. As I was talking, I was telling in the previous topic, like almost 3 liters of uh, water should be included. Either not should always make sure dehydration you have to be included like coconut water, buttermilk, or any kind of fresh fruit juices. Either 3 liters is more important in your daily diet. Drink small amount of fluid during the day, but not try to avoid the water, the fluids. Okay. Food safety during the pregnancy is most important. The proper food safety during the present pregnancy, preventing from the foodborne illnesses like infections. The most of the infections different, mostly we get from the bacteria and parasites in the foods, which can affect your baby even if you don't feel like sick, because getting outside food and eating it, preservating for the longer time. Okay, and always make sure raw seafoods to be avoided, unpasteurized juices, ciders, and the milk should be always boiled well, cooked well, and should be included. And always packed juices should be avoided, preservatives especially. The soft cheese, the uncooked eggs, the pastas, the chickens, which is cooked at the good temperature, and egg, make sure it is boiled well, and raw sprouts, okay, which is more developed than the bacteria, and the sprouts and when boiled like pulses like chana, green gram can be included in the form of boiled, but not sprouted for the overtime for the longer days. Okay, if it is 1 or day, it is okay, but the longer days, the more the extensions, the time goes off, and the bacteria grows there. So the uncooked meals and quantity should also be avoided. Make sure you always cook well, and preservatives, and it should be avoided. Always clean it properly, wash it, wash the surface, clean it, and separate it. Always do not keep everything together like fruits or meat products together. Always separate everything. Keep it, cook it in a in a in a weekly basis, but do not store it for the longer time. As the I was talking about, always cook in a right temperature, and do not store it for the longer time. Okay, and exercise is in pregnancy. Yes, exercise is in pregnancy is important. Exercise can help you to keep you at a good weight. Okay, and not increasing too much of weight. Like as I was talking about in the first slides, first, like gaining too much of weight, it is not at all good. And increasing like almost 2 kgs or 3 kilos in a month, it is not a good weight. Okay, gaining like 1 kilo or 1.5 kilo as the trimesters goes, as a pregnancy journey, it depends on your count, the calorie count, depends on your uh, this one trimesters. So gaining too much of weight, which is not at all, it is weight puts risk for the longer labor and the tougher delivery too. Gaining too little can hurt your baby's growth. Like many people will be like they'll be cutting down the calories. So too little gaining of your weight can get hurt up your baby's growth. Always work with your doctor or a dietitian to set up the right weight goal for you for the healthy pregnancy. So always good nutrition during pregnancy, the best start you give to your baby. So always go with a good nutrition, a well balanced diet is more important in your daily on a healthy pregnancy journey. Thank you. Any queries? So the question is like, what food should be avoided during the pregnancy? Yes, Pinky, it's a very good question. Like foods to be avoided, like spicy, too much of masalas, like outside foods, which makes you like heartburn, like too much of warm things, which is not at all safety in your pregnancy journey. Try to avoid outside food, processed food, too much of sugars, too much of salt should be avoided. And the other question is like, can we eat a seafood during the pregnancy? Seafood you can be included, yes, but a low mercury fish. Okay, always a mercury fish should be always should be on your notice. A low in mercury, that salmon can be included, but too much of mercury, which is not good for your iodine as well as iodine is good, as I was talking about, which can make the baby feel taste as well as the move around. And but make sure do not go with a lot of iodized mercury and iodized seafoods. Low mercury seafoods can be included. Again, the question is like, which is the best way to gain the calcium in your my diet? Best way as to calcium rich foods can be included like milk and milk products again there like cheese, that is also cheese, paneer can be also included, and also the plant sources like sesame is also good, but depends, and it should be planned like when to it and when should be added in which trimesters, like sesame seeds as well as the cheese and the paneer, which is should be think about, and the trimesters is more important in early weeks, not in the early first trimesters, but you can include in the second or trimesters. And main thing is calcium, which you can start up milk and milk products, which you can start from your first trimester itself. What is the best way to get more iron into your diet? Again, it's a good question. The iron is most important and which makes the double in your pregnancy. The way the iron, which which gives you the more important, which makes the blood supply to the tissue. The iron-rich foods, which are it should be included more from the green leafy vegetables, fruits, as well as nuts. To absorb well good amount of iron, try to include vitamin C. How to manage weight gain during pregnancy? So weight gain in pregnancy, as I was talking about in the slides, weight gain is more important. So like almost like half a kilo, like 500 grams to 1 kg, you can gain in your first trimesters. Depends on the BMI. Okay, like how much BMI. If you're overweight, there you have to be in overall your pregnancy or in the 9 months of your pregnancy you should be gaining around 10 kgs. If you're obese, like almost if you're 30, if your BMI is almost 30, you have to gain around only 8 kilos. Again, consult your dietitian where she can plan accordingly, where the trimesters should, all the extra calories and extra protein should be included. It has been calculated accordingly to your BMI, which the good weight gain is more important in your pregnancy. So how much of caffeine consumption is allowed during pregnancy? It's a good question again. And so many women who likes the caffeine to add up every day, which has been habituated, and so try to include 200 grams per day. Like caffeine almost should be avoided, but you can include less than 70 ml to 100 ml per day, but not more than it. Only half a cup or 1 cup in a day can be included, but make sure you try to avoid not more than 200 milligrams per day. is non-veg food safe during pregnancy? Yes, non-veg is safe in pregnancy, but make sure you have to be cooked well, washed well, and to meet up the protein sources is the main protein we get from the non-veg. So you can include chicken, fish, as well as lean meats, which and mutton also you can include it, but it again planned according depends on your fat consumption. How much are you taking in a day? Again, it is good and safe accordingly, which is well cooked and not spicy and cooked well. I am craving a lot more sugars than would normally eat. So, sugars, salt cravings are the common symptoms in your pregnancy journey, Pinky. But sugar, lot of sugars, including in your diet, which makes the more calories and you may put on weight, as well as you depends on the complications, how much it is varying, depends on the sugar levels also. According in the pregnancy, anytime preeclampsia as well as gestational diabetes may occur, but make sure you always cut off your sugars from your diet. If you're craving for the sugars, make sure you choose a ready-made like fruits as well as fruit bowl also can be included, and different fruits and different healthy snacks which are made up of jaggery in the form of laddu, like dry fruit laddu you can include it, or else you can include like peanut chicky in the form of, or else moong dal ka laddu, like normally in the Indian, like we call it as sununda, which is more healthy for the bones, which is made up of pulses, which iron, the jaggery, which is more in iron. So think in the form of healthy snack can be included, but not too much of having chocolates or ice creams. To cut off your, make sure you cut off your sugars from the simple sugars. You have to include from the healthy form, but not in a like simple cups. Any advice or tips or relieving in the constipation? Yes. Tips of relieving the constipation is try to include like 2 to 3 servings of vegetables in your diet, like in a meal. Like almost you can include 2 to 3 servings of fruits every day, and make sure you have 3 liters of water, which will make you to relieve the constipations. The more fiber rich foods, which relieves you more in constipation. Any other query? Thank you all.